The member for Hughes.
My question is to the Minister for Health. Will the Minister outline to the House on the action the government is taking to ensure more Australians have access to their GPs, especially in my home state of New South Wales? And is the Minister aware of any alternate approaches?
The Minister for Health has the call.
Thank you very much, Mr Speaker, and I want to thank the member for Hughes, who's been a great friend of those who face challenges with disability and special needs and special services, and has therefore been a genuine medi-friend and a supporter of their access to better Medicare services. Now, this compares with others elsewhere who might be called medi-frauds. These are people who say one thing about Medicare but do the opposite, like those on the other side. Now, let me give you an example. On this side, what we see is record bulk billing rates announced last week. Record bulk billing rates. In the seat of Hughes, the figures are 4% higher for bulk billing, which means that people get to visit the doctor without paying a cent than they were when Labor was last in office. Across the country, what we've seen is an increase of 4.2% on the September 2012-13 quarter, right through to what we see now with the recent September quarter. So a 4.2% increase from Labor's last full September quarter to our most recent September quarter. That means hundreds of thousands of additional services for free under Medicare. But it's not just that across the country. That's also the case with additional Medicare services in Bennelong. But we see some claims that there have been reduced services in Bennelong which are simply false. We know that a former Labor Premier, Christina Keneally, made the claim that there had been cuts to Medicare services in Bennelong. And these claims from somebody who has been described as Eddie Obeid's puppet, not by us, but by another former Labor Premier, are false, untrue and incorrect. Because in Bennelong, the national average has the average bulk billing rate has climbed to 88.5%, which is above the national average, and that is a fundamentally important change. And at the same time, we've seen other claims which were false by Christina Keneally. Christina Keneally claimed that we had closed the Medicare office there. In fact, that claim lasted until it was shown that the member for Sydney had set out this closure in 2010 for every Medicare office. But most significantly, we've seen that Christina Keneally's claim that she had to wait for an hour for Medicare services was absolutely false. In the week that she claimed that, the average waiting time at the Medicare office was 13 minutes. And how many people had to wait an hour, as she claimed? Not one person. So these claims were false, untrue and incorrect. You cannot trust Labor and you cannot